we would like to welcome Kirsten Koppang Telford. She is the COO and Co-Founder of ePACT Network. Kirsten oversees the system development to ensure it provides critical support to organizations, individuals, and communities across North America. Since ePACT's inception in 2012, Kirsten has been advised by leading pediatric allergists and emergency medicine doctors, and has engaged with stakeholders from public sector, including emergency management offices and parks and recreation departments, to schools, sports programs, and individuals, all to ensure ePACT not only fills gaps in responding to emergencies, but helps to build safer, more resilient communities. Thank you again, and I'll turn it over to Kirsten.
Thank you, Josh and Julie. And first of all, I'll apologize if my voice is a little froggy this morning. I'm just getting over a cold. But thank you very much, everybody who has logged in today. And thank you, Julie, for the introduction. As Julie said, ePACT is an online emergency network. We're a service that allows individuals to create a single online emergency record, store it securely in one place, and connect that record to organizations in the community, such as parks and rec departments, that may need their information to support them in an emergency. I think you've heard enough about me, so we'll jump right in. I know with the start of the new year, recreation organizations everywhere are preparing your programs for the months ahead. You're getting ready for spring break. You're getting ready for summer camps already. As we sit here in the pouring rain in Vancouver, that seems hard to believe. Besides the obvious tasks, you and your staff are responsible for providing a safe and secure environment for participants of all ages. So whether your organization is large or small, or whether you host single programs or a variety of activities, and whether those activities are on-site or in multiple locations, your staff are aiming to provide families with peace of mind while participants are in their care. So a large part of that rests in the information that you collect to support participants in the event of a crisis. From emergency contact information to allergies and dietary requirements, being able to support your participants when they need it the most adds value to your program offerings. It also assures parents that you have their children's best interests at heart. So today, what I'd like to leave you with will be 4 key takeaways. First of all, avoiding the collection of critical information for your will impact potentially your organization and the safety of your programs. I want to talk a little bit about what type of information is important to collect from families, and how that data is key to your safety programs, and also talk a little bit about how to get buy-in from your families as you perhaps begin to collect that information or look at taking that process a little bit more seriously. And finally, in that vein, I will touch a little bit on the privacy and security of information. So before we get started, what I'd like to do is get an idea of what type of information that everyone's organization are already collecting from families across your programs, and recognizing that depending what part of the organization you're representing, you may collect a lot of information, you may collect none at all. So you'll see the poll on your screen, and we'll just give you a few minutes or a minute to respond. And it looks like as the results are coming in that so far everybody is collecting at least emergency contact details, which is great. And it sounds like a lot of you are collecting a lot of information. But we do have a variation between organizations that are letting us know here that you're collecting a little and those that are collecting a lot. So today we're going to talk through why that difference, and if you are not collecting that much at this point and looking at expanding your emergency programs, how to address that. So looks like we're done on the response, and I'm going to go forward. So why do we hear from some recreation departments that they avoid collecting information? And we do in some cases hear organizations collecting really nothing, or maybe limiting it to one emergency contact. Obviously, in some cases, there's just a feeling that you don't need it. Maybe it is a program where there's always a parent on site, and it just isn't really that critical. In many cases, it's a challenge over administration. There's not a source where you can store this information securely online, so you're doing it on paper. You're dealing with tons of administrative time, inefficient processes, cranky parents. And in other cases, we've realized that some organizations are just unaware that the information that's being collected just isn't thorough enough to meet the emergency response needs. Luckily, most of the emergencies that you're likely dealing with are solvable with a Band-Aid or a call to mom. But as we'll talk about as we delve in a little bit more, the importance of having more comprehensive information can be critical in being able to respond quickly in a serious incident. So what information should you be collecting? I'm going to talk in a little bit about the different types of information you might need for different types of programs, but in general, here's the kinds of details that can be vital in responding to a serious emergency, or even better yet, in preventing one from happening in the first place. Obviously, the emergency contact details, names, phone numbers, email addresses. We're seeing certainly as communications mechanisms change, a shift in collecting mom's home phone number to really being aware of how people can be reached throughout the day, whether that be by text, on a mobile number, or through some other mechanism. We're also seeing an increasing number of organizations that are looking for addresses for emergency contacts, and that can come out of either the need to be able to verify somebody when they're picking up a child, so having a secondary checkpoint on a driver's license, or requesting that information to support reunification of families in a more serious disaster where we may not have communications infrastructure. Allergy information is probably the number one area that we see expansion in emergency information being collected. It seems that allergies are becoming more and more prevalent each year. And what we're seeing is a move towards collecting more prescribed information about allergies. So instead of just tell us if your child has any issues and leaving a big blank space on a form, actually looking for specifically what are your children's allergies, what kind of symptoms can we expect to see if they are in contact with an allergen, and what exactly do we need to do. And there's been some cases in the news lately that have shown what can happen when that information is not available. Dietary requirements. I'm sure anybody who's dealing with residential programs or dealing with feeding kids, this is also increasingly complex, whether it be food allergies or it be related to different religious dietary practices, lifestyle choices, and other kinds of special diets. Medical conditions. We're looking for usually medical conditions that may be current or significant medical conditions that may be relevant in a medical response. And then finally, any special conditions that may be, whether they be physical or behavioral, that may impact the safe delivery of the program. And in that case, may be an issue of safe delivery of the program to the child from whom you're requesting the information, or it may be relevant to the other participants in the program as well. So a second poll question, throwing some more work back to all of you. I'd like to hear what your biggest challenge is in managing medical and emergency information. And I've said the biggest challenge, but feel free to pick all that do apply. If you've got several challenges, please feel free to pick any that apply. I see that in some people's cases there is a picture that's blocking the, oh, now the picture is blocking them on our end. The first poll question, I'll read them out in case anyone's having trouble seeing them, or the first response is following up with parents about forms that are incomplete, illegible, or not submitted. So nagging parents is the first one. Keeping the information accurate and up to date is number 2. Safely storing forms and information, long-term or short-term, ensuring only authorized staff have access to the information, and the ability to access information quickly in an emergency. We'll give everybody a few more seconds here, and now it looks like we've got a better view of it now. Okay, to our audience, can you all see is there anyone who's still having trouble seeing the poll questions? Doesn't look like it. Okay, it sounds like most can see it. Great, excellent. Okay, so so our responses, interesting. Our number 1 response is accuracy, and that's consistent with some research that we have done as well. One of the things that we did when we first started ePACT about 6 years ago is we worked with some local schools to see how their information was being collected and how accurate and up to date it was. And we had a grant to research information accuracy over the course of 6 months. And what we found is that between September, when that information intake typically happened, and April, when at the end of our test period, more than 30% of people's information had become inaccurate, which was huge and was very surprising to the school. But it looks like from your responses, it's not that, you're not too surprised to hear it. People typically, whether they're filling out a piece of paper or they're putting some information into their account on your online, they think of it as paperwork and they forget about it 3 seconds later, and they don't necessarily think about the fact that a cell phone number changed and where they've shared that information, or they get a diagnosis at the doctor and don't necessarily think or know where to go back to update it. I think the other one that is high, there's a couple more responses to it right now, is that first one, which is following up with parents after about forms. And certainly we know that one of the things that we hear the most in terms of collecting this information is convincing people that it is important and having them take it seriously enough that they fill out a form and it's actually legible and useful when you need it. And we'll talk a little bit more about how to deal with that. Some of you've also talked about the last 3 options, which are all very closely related, which is really as this information comes in, how do you know that it's securely stored? It's funny, most organizations have been doing this on paper forever and not thought nearly as much about the security of that information as we do now that it's online and we have the option of further security and the ability to track where this information is and who has access to it. Okay, so jumping back into the question of all that information that we went through, what should be collected and how does it differ across programs? The basic rule of thumb that we use is collect only the information that you need to plan for a safe program, to address an emergency situation that's a possibility in the program you're running, and then to meet any legal requirements of your organization or, in the case of licensed childcare, your licensing body. On the high end, you're dealing with overnight camps, residential programs where you're going to need everything from dietary information to medical information that may be important and that you're going to need to have when a parent may not be reachable by telephone. If you're dealing with sports programs, you're looking at information that's perhaps more sport specific, so information that you might need to know ahead of time to make sure that you can deliver a safe program. Are there any pre-existing conditions that are going to make it more difficult for a participant or that are going to require you to make any adaptations? And then what are the types of incidents that might become relevant, whether someone's in the pool or they're out on the soccer field? On the sort of in the middle of that are your daycare programs, your out-of-school programs, where you're going to have a range of activities running. You're going to, again, have an issue where when something comes up, as much as mom and dad may say, no, I'm always available, just give me a ring, it's having that information that, that may be required because mom just happens to be out of cell cert range today, or because calling a parent and telling them that you're in an emergency situation and having them convey the information that you need to then turn around and convey to a paramedic just may be not possible or not easy in that kind of situation. From the perspective of legal requirements, we're seeing increasingly at the state level, in states like Colorado in particular, requirements for fairly extensive emergency information in child care programs. And that can be helpful when you do have that state level guidance because you see consistency across not only the programs that you're running but the other programs in the community. And that, I think, is helping to build awareness among parents of why this information is important and how to and what should be provided. You likely also are dealing with different waivers and consents for each of your programs. So whether that be medical waivers, clearance to do everything from apply sunscreen and be able to quickly look at who has consented to that versus who hasn't, to waivers to provide medical treatment. And finally, obviously, your licensed programs will have often very prescribed emergency information that needs to be not only collected, but that you can easily turn around and show a licensing official that the information is there and is retained correctly. So why do we care about this? So as I said before, fortunately, most emergencies that you're dealing with are small, and they're easy to deal with. Your staff is trained to deal with basic first aid or to deal with smaller situations. In a more serious situation, having easy access to legible, concise emergency information, as you've all identified, can make an absolutely huge difference, and sometimes even a life and death difference. So where does the information fit in as you're creating your safety plan? First of all, having the information ahead of time, and this is something that it's not always possible. It's particularly challenging when you're collecting a paper emergency form. You're having people fill out this information perhaps at drop-off on the first day. But if you can have information ahead of time, and you can have that information in a format where somebody's not having to scroll through and aggregate all of the information, you can put in place systems to have it at a glance. You can plan for your program more easily. You can pull up and say, okay, who do I have that has allergies? What's the severity? Let me flag who could potentially be a problem. Let me be prepared to inform other parents of those allergies, have a sense. And I think also being able to prepare to whatever extent possible your staff ahead of time, so that if you have a sense of the most likely incidents that might crop up over the course of a summer program, you can prepare your staff and give them the confidence that they have the information and the knowledge of what to do in various situations. Having information at your fingertips. So most of us get the importance of knowing some emergency information. What we hear from organizations often, those that aren't collecting very extensive information, is, we know this stuff. If a child has an allergy, their parent or guardian at drop-off lets us know they've got a peanut allergy. And that, that verbal communication of those things is super important. It's super important to have those conversations with parents. The challenge is that when a staff member is faced with a child who's maybe having an anaphylactic reaction, or they're seeing, and the symptoms of that anaphylactic reaction can actually, the early symptoms can be quite varied. They're panicked. They need to call 911. They need to contact a parent, and they need to try to remember what it was the parent said about that child. That's a very big onus to put on somebody on the front line. So having that information available, having whether it is a piece of paper or it's an online a record on a mobile device that they can turn around to a paramedic, can be huge. So, and finally, obviously, that emergency contact information, having current emergency contact information, knowing how that contact information will be used in an individual emergency, as well as how it will be used in a mass emergency that may be affecting multiple children or multiple participants in a program, or the whole organization, or even broader. So the next question is families, and how to help them understand the importance of collecting this critical information. And I think that goes back to what you've all identified through the poll. You're not getting parents to provide this information in a timely and legible manner. And you're not getting updated information, which means that we have a gap in families' understandings of the importance of this information. And what we've found is the bottom line on all of this is obviously parents have their children's safety, it's is the most important thing. Once we communicate well enough with them and they understand what this information will be used for, they take the blinders off of, I don't want to tell you I don't want to tell you my intimate details of my child, and understand how this information will be securely stored and so on. We see a totally different experience. And I'll give you a little bit of a personal story of why we started ePACT in the first place. Back in 2011, a very close friend of mine went through the earthquake and tsunami in Fukushima, Japan. She was separated from her children for 3 days. They were at school, and she was a couple of hours away in Tokyo on just a one-day business trip. And she didn't have proper information in place with the school. There wasn't sort of alternate people authorized to take the children, and it took about 12 hours until somebody authorized could get to them. So for myself, I'm a parent of 2 young children, not so young anymore, and when I sent my kids back to school that fall, and I started scrawling out that paper emergency form in my probably, unfortunately, usually illegible way, I finally got it. And I finally realized that this information was not just paperwork, that it was going to be used for something. And I realized that as a parent, I had no idea how it was going to be used. The paperwork I was filling out was for a emergency release situation. It was some medical information and an emergency contact who would be authorized to walk to my children's school and pick them up in a earthquake type of situation where I might not be able to get to them. And what I realized when I looked at how I had filled that information out for the previous 3 or 4 years, I had been putting down an emergency contact, my friend Tanya. I wrote her down every year because we were good friends. I knew she wouldn't mind if I wrote her phone number down, and because I remembered her phone number by heart and I could do it really quickly. Well, Tanya, we live in Vancouver, close to the water, and my friend Tanya is lucky enough to live right on the water, but she lives in a place that's only accessible by boat. And I don't have a boat. So my whole emergency plan was based on her getting in her boat, getting up, docking the boat, walking to the school, getting my kids, bringing them back to her house, and my somehow knowing that, and I don't know, swimming to pick them up. So obviously, that was kind of an eye-opener for me, and I've used that example lots of times. But I've also used with parents the parents that say, "No, you just call me. I'm always available. I don't need to tell you anything." We use those examples of, is your cell phone ever out of range? Do you ever go to Costco during the day and not have and you're on the other side of the bridge and can't get back to the school? So those are the kind of examples. If you and your staff really understand why you're collecting this information, it becomes much more easy to convey that to parents and get their buy-in. So whether that is just being able to answer their questions, providing a little bit more information when you're handing this information out for them to fill out, having a little bit of information in your registration packet or your reg guides on how your emergency programs work. That can be really helpful. And you're of course welcome to use the story of my stupidity and my children left on the water potentially in an emergency. You also want to make sure that parents have an easy way to ask questions. And when we get to the next slide and talk a little bit about information security, it's a common question that they'll have. Who can see this information and why do you need it? That information, as I said, can be provided on a website. It's also nice if they have a way that they can contact you, whether it's walking up to the front counter, asking one of your staff members, or a way to email in a question. And finally, to that information update point that you all brought up in the poll, making it easy for families to update this information is key. I mean, one of the reasons that you often don't have up-to-date information is if you've collected information on a piece of paper, parents need to know that that is information that's accessible every day when they drop off at or pick up at an out-of-school program, and that they should be providing that information, or they should have an easy way to log in online and do it, and a nudge and a reminder to do it. So if you would like some information, additional information on that area, I've just put up a link to an article that is on the NRPA blog from November. Okay, so theoretically you've figured out what information you need. You've convinced parents to give it to you, and now what do you do with it? The keys here are making sure that your information plan includes a way for the information to be securely collected, that you've thought through who should have access to that information and for how long, how it will be accessed, how parents will update it, and how to manage that accuracy. So as a general rule of thumb, sorry, I lost my place. So I was going to say, this topic in general is one that we could spend a week talking about in terms of managing your privacy. But the key to it is really thinking through those basic steps. Any information that you collect should be collected and stored securely, whether or not that is collecting information online and ensuring that the site through which you're collecting it is secure, or that if you're using a third party to collect it, that they have security standards, privacy standards in place. For the collection of medical information, if you are collecting health information that you will be conveying to medical practitioners, HIPAA is the bar that you want to make sure standards are set to. Information that's kept online should obviously be kept secure with a password. And when you're looking at how that data is collected, there's a security portion of collection. There's also the retention and access part. So if you're collecting information on paper forms and it's stored in a binder, who should have that information and when? Is it in a binder in the backpack when you're going out on a day trip? Probably should be, but at the end of the day, is it securely locked up? Is it laying on a counter where anybody can access it? Hopefully not. Many of you will have different retention requirements for your information. They may be set by your organization. They may be set by your licensing body. So we see retention across the country ranging from, no, we are supposed to destroy any records immediately at the end of the program. More commonly, we'll see retention practices that require storage of information for 1 to 3 to 5 years. In some states, we see the requirement to keep information until the child is at the age of majority. So knowing how that retention practice is going to be handled is important. It may be archived in cardboard boxes. It may be archived online. One of the things that is often missed in that retention practice is actually the disposal practice, and ensuring that at the end of that 1, 3, 5, 18 years, the information is not sitting in a storage cupboard somewhere that's been forgotten about. So again, in terms of access to staff members, the ideal, and this is one of the key things under HIPAA, is to have especially health information available only to the staff that might need that information to respond to an emergency. So that means having a way to limit access to counselor that's running this week's program can see kids' information that are attending this week's camp, as opposed to having your health information available generally to anybody who can log into a system or anybody who can grab a binder off of the shelf. The other thing is having ways to track that access and know, ideally, if somebody has looked at some information, to know that they have and be able to track why. Which is a tough balance with staff need it, only the right staff have access to it, and it's readily accessible in an emergency. So in summary, before we jump into questions, again, to recap, four main things. Make sure that you're collecting the right information from families according to your program. Consider that information a key part of your organization's safety plan, and look at how to make sure other stakeholders, whether it's the parents or your staff, understand that this is not just a piece of paper that licensing is making us fill out. Help your families to understand the importance and the value of this information and why you're collecting it and how you're storing it, so that you do have that buy-in. And then obviously always keep that information safe and secure however you choose to manage it. So before we wrap up, does anybody have any questions? Okay, so we're getting some. Thank you to everyone who has participated and responded. It looks like we've got a few questions coming in. Are there specific locking requirements for hard copy data? Thanks for that question, Luke. It's likely that there are requirements if you're a licensed facility. You may have state or health authority level requirements on what is locked. When we store information online, there's very strict requirements on access to it. But we don't see a lot of requirements around the locking of paper forms. You know, when they're out in a backpack, locking filing cabinets, if you're storing information overnight or you're retaining information, tends to be the standard in information security for longer term storage. Any other questions?
If there's no other questions, we thank you very much, Kirsten, for your time. I would like to remind everyone that this webinar was recorded and is available shortly after in the same location you found this if you want to bring other people aboard. Also, there's another question for you in just a moment here about what services does ePACT provide. Kirsten, you want to take that?
Sure. So for Parks and Rec departments, ePACT provides a platform through which you can request emergency information from your participants. You can then track the response to that request, set what fields are required and so on, so you know you're getting a certain standard of information. You can automatically remind people people if you haven't seen that information come in. And then through the platform you can actually query that information, so you can generate reports that will give you at a glance a breakdown of what of participant medical conditions, dietary conditions, and so on, so you can carve off information if you need to send that for food preparation or break it down for particular subgroups. You can set access to the information to only people that need access to, say, a subset of children participating in Camp Group A this week. So you can give access to the counselor to just that group, or you may give the recreation supervisor access to all the kids attending this week. That access can be done online. It also can be done on mobile device. So we do have a secure mobile app that allows you, if you're taking groups of kids out, or even you're just out and about in the facility, or you're on the pool deck, you can pull up information securely on the app, whether you have an internet connection or not. We also do have the management of waivers and consents in ePACT, communications services that you can use to send emergency communications out to your members by text, email, and voice, as well as archival services. So if you are collecting the information through ePACT and you need to be able to, say, archive that information for the next 5 years and have it automatically deleted, or notify you when 5 years is up for the current cohort, we have that service as well.
Well, thank you again, Kirsten. It was a very informative webinar, and I'm sure our members got a lot of useful information out of this. It was very practical as well. Just a reminder again, the webinar is recorded and can be accessed in the same location that you found you came onto this webinar. Also, if you're looking for CEU credit, please return back to the product and answer the brief assessment so that you can access your credits for this webinar. And finally, I would like to remind everyone of the other online learning opportunities that we provide. So please take some time and browse around learning.nrpa.org and see if there's any other online learning that might meet your professional development needs. Thank you once again to Kirsten and ePACT, and this will conclude our webinar.